Honorable Chairperson, respected panelists, learned audience, welcome to all. It's my pleasure to be here to present my topics. My topics is MICS, Endeavour to make cardiac surgery widely acceptable, our experience. This is the one and only largest government institute in Bangladesh called the National Institute of Cardiovascular Disease. I am here the working person, and I am here working as an associate professor of cardiac surgery department. In our institution, there is 1,250 bedded hospital, the newly decorated ICU, and total operation theater is now 7 number, 2 different vascular OT, and the daily outdoor patient is around 700 to 900. Now, I will show you a short video clip that was viral in social media in 2019. Here we can see a young lady is working in a table. Suddenly, she fainted and caused death. She was a case of post-MVR patient. In her daily personal life, she was unmarried. She denied to get married because she was in fear if her conjugal life, they would be not work out in her conjugal life, because she underwent a heart surgery. There was a large scar mark in her chest. For that reason, she denied to get married. There are thousands to millions stories in our country or in the whole of the world. There are, in our society, there are lots of social stigmas. The stigmas are fear to cut the chest, fear to invasiveness of the procedures. The young female lady or the female, they are afraid of to get married, and they are afraid of their social life after the heart surgery, because there are large scar mark in their chest. CVD candidates rethink of doing operation prefers the incomplete vascularization by stenting. In our young children, the female children who are in the school-going children, they are facing bullying in the public, in the society. MICS is the best option for them to prevent the social stigmas. MICS means a small chest incision that does not include full sternotomy. There are some incision approaches in the carpenter. Nowadays in Bangladesh, we are doing micro incision. In our team, regularly doing that. These are some pictures. We can see the incision approaches of minimally invasive cardiac surgery. Now, why we shifted to MICS? It is safe, less invasive, it is reproducible, faster independent ambulation, no external complications, better cosmosis, faster and complete functional recovery. Nowadays, with the cardiac surgeon, face some requests or ask for some questions. There are so many guardians came to our chamber or in the hospital. They requested to us that, sir, my daughter or my wife or my brother or relatives is suffering from a hole or in the heart or valve problem, or there are many blocks in the heart. They are unmarried or they want to they are unable to do the surgery by cutting the chest wound. I heard about the surgery through the hole. Can you please do it for my children's future or my relatives, or fix it through the hole? These are the common requests in nowadays. If we see the current scenario of the worldwide, we can see the MICS procedure is more popular day by day. In the Europe, we can see that the percentage of isolated valvular heart procedures done through MICS is, in Germany there are 50%, Italy France, Spain, Denmark, there is range is about 20 to 25%, and our native country in India, we can see that in 2019 they did 4% of total valvular cases through MICS. Coronary cases they did 5 to 6%, and congenital cases they did 3% of cases. Now, in the current situation, in our unit or our team, we did the 95% of MBR cases through MICS. Around 70 to 70% AVRs we have done through MICS, and near about 40% cases we are doing DVR. Last, we are doing around 25 to 30% CBG, single grafts and multiple grafts through a single hole. Now, the scopes and opportunities are MICS is the popularity of MICS is increasing day by day in Bangladesh. When there is a scope, people will grab the less invasive option for sure, if safety is ensured. Now the question is it possible to perform all the possible cases through MICS? My answer, the future will answer it. There are a lot of limitations. There are shortage of adequate number of trained cardiac anesthetics, inadequate infrastructure, lack of adequate training facilities. The challenges we have faced that there is trust issue arising in patient as well as other professional colleagues. Our MICS journey is started from congenital. Now we are doing multiple grafts. These are some procedure of MICS CABG multiple grafts and the DVR cases. So we can see the harvesting of the lima, and simultaneously we can see the insertion of the mitral valves and the lima to LED, and we can see here and the aortic insertion of the aortic valve. Then the proximal graft is given, and the RSBG to OM1 and the PDA sequential we have given in MICS CBG multiple grafts. Now, our MICS journey at a glance, the male-female ratios and the lifestyle of the post-MICS patient. This is the Hasina Begum, DVR patient. Our daily routine life, she is doing her daily routine lives and doing her heavy work, and her recovery is very smooth and very fast. This is the multi-vessel grafts MICS patient, Mr. Alamin. He is doing very good. Now, difference is evident. Less risks of infection, less scarring, shorter hospital stay, less pain, soreness and discomfort, much quicker recovery time, can get back to work much sooner, overall less trauma to the body. Our take-home message is, if you can ensure the optimum benefits without compromising the safety, then less invasive option should be on the top of the list. Conclusion is, acceptance is observation of life and suspension of judgment about whether what is happening in good or bad. MICS already gained that source of acceptance among the people who need cardiac surgery in Bangladesh. Our inspirational message, thank you all, and thank you to my team.